Yeah, the Democrats promise, you've seen all this before, you can keep your doctor, it will be affordable, yet so many people have just been dropped, premiums are soaring, and deductibles are huge. So, we asked our viewers how this has hurt them. We got over 100 responses in a couple of hours. First off, listen to this from Chris. Got kicked off my old plan. Premiums up 400%, co-payment up 150%, deductibles $2,500 when before it was $250. Basically, we've been screwed, and I'm not on Obamacare. This is what the law has done to me. Dr. Ezekiel Emanuel, architect of Obamacare, is with us now. Would you, sir, please just respond directly to Chris and what he just said and what he just wrote to us? Go.
Sure. First of all, I'm very sorry for him, as you know, creating a piece of legislation that's going to cover 310 million people. You have problems, and we've discovered problems, and Democrats are proposing solutions to some of those problems. But we also should not have amnesia. The situation before the Affordable Care Act had 50 million people uninsured.
Is that
would you let
Doctor, no,
would you let me
look? I'm running this.
Would you let me finish?
Apology? Is it an
would you
apology
treat me like a guest
Chris?
Instead of your punching opponent,
is
so
it a,
I can be here and respond?
To Chris, is it? I mean,
you
apologizing?
asked me to respond, and I'm responding.
Okay, now
we
I've got
need to
another one for you.
compare
I want you to
before
respond to
and
one.
after.
Put it up on prompt.
And I am really sorry for Chris.
Right.
But
Here's another
we also need to
reaction
remember 50
to
million
Obamacare.
people were uninsured.
Okay.
Many people could not get insurance because of pre-existing conditions.
Okay.
And
this
we have also
one
reduced the health care inflation rate.
Okay. This one is from Mark. Can you hear this? My monthly premiums in Arizona went from $400 a month for 3 people to $850 a month. My deductible went from $4,000 to $10,000 the month Obamacare went into effect. Ask him, that's you, sir, why my family's premiums went up and Obama said they would go down. What's your answer, Doctor?
Well, I'll tell you, actually. My answer is, if you look at healthcare inflation, we've brought healthcare inflation down. And the main way to keep premiums down is to keep healthcare costs down. And Obamacare has done more to keep healthcare costs down than anything we've seen in the 50 years previously since passage of Medicare and Medicaid. It is very unfortunate that insurance companies have taken an opportunity to raise rates very high, but that's a result of healthcare costs going up. And we need to keep total healthcare costs going down.
And
the Democrats have very good plans to do that.
They're losing billions. They're losing billions, and they're leaving.
No, the insurance companies are not losing billions. Their stocks are at record highs.
They're
making actually
billions.
record profits.
And they're leaving.
No, they're leaving. Look, Aetna put in a letter. It's leaving for political reasons because the government didn't want to create a monopoly by allowing it to merge with Humana. That's why Aetna is leaving. The CEO put it in a letter.
I watched you last night with Megyn Kelly, and you were discussing the problems of Obamacare, and you came up with what I think were 3 fixes. Here's what you said. You want to increase the subsidies, that would help, increase the fines for not having insurance, and restore payments to insurance companies from taxpayers. Those were the 3 fixes you put out last night with Megyn Kelly.
That's because she also, like you, keeps interrupting me. But I think those 3 fixes, and by the way, that's quote-unquote subsidies, they are risk corridors, and I should say that when the Republicans passed Medicare Part D, they had those kind of risk corridors in for the pharmacy benefit management people.
How do you do this every single time?
Because I know a lot more about the health care system than you do.
It is always the Republicans' fault, isn't it?
No, I didn't say it was their fault.
You just heard
I didn't say it was their fault. But they do make mistakes on health care very frequently. And by the way, they don't have a plan that's better than Obamacare. And that's become obvious over the last 6 years where no plan exists.
I think this should go into the election campaign. I think voters should be told that Hillary and your fix for Obamacare means fining people more, bigger subsidies going to the insurance companies, and increase the subsidies for insurance companies and give them some more taxpayer money. And increase
These
the
are not subsidies to the insurance companies.
I think we should vote
on
it.
They're risk corridors because of unpredictability and to give people predictability in the system.
Let's vote on it.
And by the way, Republicans gave them to the insurance companies when they put in Part D because, again, we couldn't know what would happen in the marketplace.
It's okay.
And Republicans found them acceptable.
Why can't we vote on it? Can we?
Look, I think if we had reasonable people, there's actually a lot of agreement between conservative and liberal health policy people about the correct solution.
Are you advising Hillary Clinton on how to respond to Obamacare's problem? Are you advising her?
What I would suggest to you is that what we need is to shore up the exchanges, because it'll be a bad day in America and a bad day for conservatives if the exchanges do not succeed. So I've suggested some plausible ways of actually making the exchanges work. Interestingly, you have no alternative, and nor do Republicans.
Increase the subsidies to consumers. Okay.
Yes.
Taxpayer money. Increase the fines.
Let me just say something.
You want to fine people more if they don't have insurance?
Republicans have endorsed enhancing the mandate penalties for precisely this reason.
You want to fine people more?
Republicans want to do it.
I'll take that as a yes. You want to fine people more. You want to increase the subsidies, taxpayer money going to consumers, and you want to increase payments to insurance companies. That's your fix.
Listen, Mr. Varney, you get your insurance through Fox News. Fox News, by the way, gets a subsidy to provide you insurance by a tax break. Everyone's getting subsidies in this system because healthcare insurance is expensive.
Our premiums
What are you doing with your subsidy, Mr. Varney? Your public subsidy. Mr. Varney, what are you doing with your public subsidy for your health insurance?
Our premiums have gone up, and we were assured they would not.
They've gone up much slower than they would have otherwise.
I'll take that as an admission.
And as a matter of fact,
have gone up.
Compared to projections, we have saved actually hundreds of billions of dollars for the American public.
Wow.
And that actually is because we brought healthcare inflation down compared to what it was under George Bush.
We're almost out of time.
Substantially down.
We're almost out of time, but I'll ask you again. Do you wish to look into the camera and apologize to what you've done to so many consumers, many of whom watch this program? Would you do that?
As I've said, I'm sorry for the hurt that any change has had on individual people, but we should compare to what existed before the Affordable Care Act, and the system is much, much better. 20 million people have insurance that didn't, and costs are actually slowing down.
I've got 9 million
those
people
are
have
actually
gone
positive
out onto
improvements,
Medicaid.
And Republicans
3
have no
million are getting their
alternative.
parents' insurance, and 12 million are going through the exchanges. Almost
getting
all
their
of whom
parents'
get
insurance is a good way of providing coverage in this system.
So
and
that's
many
the
of your
breakdown
viewers
of the
take
numbers.
advantage of that.
That's the breakdown of the numbers. Okay. You've apologized, I think. I think we got it.
No, I said I'm sorry, but I do think our system is much better than it was before.
Well, I'm very glad
that's
that we got
something
an
you don't
apology out
seem
of
to
you.
be able to wrap your head around.
And yet again, you stopped smiling. Come on, doctor.
Oh, I'm very happy,
Right,
but I wish you'd treat me like a guest instead of like a boxing opponent. You could have some manners.
Oh, okay. You stopped smiling. Come on.
No?
Deliver an insult with a smile. Come on. That's a smirk, not a smile. Come on. Here's your chance.
I'm perfectly fine here.
Okay. Thank you very much for joining us, Dr. Zeke.